Okay, we are ready to start. The live stream is now on YouTube, and welcome everyone to this panel on the impact of the COVID-19 pandemic. The live stream is I'm getting some. Oh, there we go. The impact of the COVID-19 pandemic, science, society, and technology. Welcome everyone joining live, and people, if you're watching this on your own time, I hope you enjoy the discussion. I want to welcome all the members of the panel. My name is Gabriela Rega Bruno. I am a PhD at the Interdisciplinary Applied Ethics Center at the University of Leeds. And I will be hosting this event with my fellow PhD, Macarena Vidal Arenas, from the University of Bristol. But before we start our discussion, I want to give our speakers a chance to introduce themselves and their work and tell us why this topic is important to them. Unfortunately, Aníbal wasn't able to join because of unforeseen circumstances. However, we have Lucy, we have Mark, and Leonora with us. So let's start with Lucy.
You might want to skip me to start off with because I'm opposite a church and there are very loud church bells. That will be over in 1 second.
That's amazing. Okay, let's go with Mark.
Okay. Hi, I'm Mark Gilthorpe. I'm a professor of statistical epidemiology, which means I focus on modeling observational data. The knowledge of what an epidemiologist has probably become more forefront in the pandemic. Remarkably, however, we seem to have discovered there's about 4 or 5 times as many as we thought there were before the pandemic, because everyone's an epidemiologist expert now. So I'm autistic, and I guess that drives my scientific integrity and robustness of research. And so my experiences, I guess, which I would be bringing to debate around this, is how that's impacted on the scientific quality that I've observed and the kind of response to a pandemic from the scientific community, which I have to confess has been somewhat disappointing in my experiences.
Well, I can't wait to hear your thoughts on this. Leonora?
Hi, I'm doing a PhD in the philosophy of disability at the University of Leeds, focusing on the social model of disability. I also am disabled. I have a chronic illness, and I serve on the committees of Leeds Disabled People's Organisation and Chronic Illness Inclusion. Yeah, so as you can imagine, I've had some interesting personal experiences throughout the pandemic and hope to try and represent some of the perspectives of my community as well.
Terrific. Lucy, are the bells gone?
They are. Yes, thank you for looping back to me. I'm Lucy. I'm an assistant professor of philosophy at Utrecht University. I specialize in applied ethics. And basically, since the start of the pandemic, I've been looking at various questions related to COVID and public policy. So various different mitigation strategies. So I'm very happy to be here to discuss today.
Terrific. I'm so excited about all your points of view, very diverse, which is the point of this panel. So we're going to start with the first area, which is about the invisible needs of many. So this discussion, I want to start it with a real example. On January 26th of this year, the Scottish government started an initiative with free lanyards and badges that were made available to people who are either at high risk of COVID or have concerns about COVID, so that others around them are aware of the need for more personal space whilst out in public. And these badges were like yellow and blue, quite bright, and they signaled, keep your distance. And this is, I think, a good example of trying to do the right thing. And I emphasize trying, because people from different minorities targeted with this initiative reacted immediately, raising concerns such as, do they even know how common attacks motivated by disability and prejudice are? And Jenny Kermode, the chair of Transmedia Watch, said, I have visible disabled friends who have been spat at, who have had people cough in their faces, who have had their masks ripped off. And now some bright, sparking government is ready to make a whole lot of other vulnerable people into easily identifiable targets. So this leads us to question how certain decisions, despite being well-intended, can create more harm. So how has this pandemic, you think, made such invisible needs more visible? And how has it made life harder for those ostracized by society, by institutional practices, and government policies? And I want to just stress, how have you seen this happening in your surrounding, and how you think we can confront the lack of proper representation and integration of different needs in different contexts? Let's start with Mark.
Okay, so I think that one of the first things I saw from an academic point of view, which was very upsetting to me, was the focus of seeing this as an opportunity. You know, the fact that the scientific community can get behind something in a big way. And I guess that the issue for me personally was that I am in that domain, and I model robustness and pursue robustness scientifically, but there's a lot of people who are experts in all kinds of fields that could contribute quite genuinely and importantly to the pandemic from a scientific point of view. And what happened, just as I say, there's been 4 or 5 times as many epidemiologists suddenly appeared overnight. There's infectious disease specialists shoot up left, right, and centre. And what we saw was an absolute flooding of outputs or scientific research that contains some really valuable stuff that people were trying to put out, but absolutely drowned in what I would describe, to put it bluntly, as garbage research. And I think that we're going to go on to discuss how communication and messaging is important. And I think what happened from a scientific community in this response is that it just forgot the little people who are actually trying to do their best, because big egos and kind of senior people who felt that they saw this as a money-making opportunity for what's known as the Research Excellence Framework, get papers that are specifically COVID related for that assessment, which we've just gone through and finished as a process that universities are assessed by. So even if it's not UK based, I think a lot of universities are driven by the publish or perish dynamic. There's a lot of perversity in the academic community to begin with. But then my experience was that this just amplified that. And all of the perverse reasons that anybody was trying to do a genuine, robust scientific task, wanting to, where they could, their skills could genuinely contribute to the pandemic effort from the scientific community, was just completely drowned out. And I think that that's crushed a lot of people. It certainly upset myself. There were certain opportunities that I've withdrawn from or walked away from because I don't feel that they were necessarily as robust or as appropriate in the way that they were conducted. Then there's the wider communication of social media and a lot of responses to various opinions that have been published. You're probably aware of the various debates over lockdowns and things, which we're going to come and discuss. And I just found that the whole output of the scientific community just really put a spotlight on itself for being completely unstable in this pandemic. We know that science isn't perfect in the sense that you always channel your efforts and get an ideal answer straight away. There's a lot of debate, a lot of learning, and the modeling that's required has a lot of uncertainty in the early stages. But we didn't, I think, put ourselves in a good light as an academic community in the way we responded so abysmally in the pandemic light. And I think that's affected people disproportionately. And like I say, from my own point of view, as somebody who's driven by passion to be robust, it just really disappointed and upset me tremendously.
Thank you, Mark. Lucy, what's your perspective on this?
So a lot of work that I've been doing over the course of the pandemic involves looking at these sorts of questions, you know, lockdown or no lockdown. I did a lot of work early in the pandemic about digital contact tracing and whether, you know, there might be ethical problems with this, whether it might be preferable to other options. And something you really notice when you're looking into the sort of benefits and harms of these strategies are that they all have this really troubling and disproportionate impact on people who are already disadvantaged in society. So we saw this in the UK. You know, there was lots of research coming out that lockdowns were really disproportionately disadvantaging women and minorities who, you know, might be in more unstable employment, you know, might be more likely to sort of lose their jobs, might be more likely to have caretaking responsibilities. But the absence of lockdown as well, you know, then you see correlations between these groups and, you know, exposure to risk. They might be more likely to work in areas where they're interacting with more people, where if they get sick, you know, they don't have as much you know, security. Again, they're at the risk of getting fired. They can't take time off. And it just really struck me the way that these options all kind of revealed these very deep underlying inequalities in society. No option was sort of better from this perspective. They all kind of made things worse in their own ways. And I think from personal experience, something that I really noticed as an academic was how different and how much more difficult it was for people who had children, who suddenly had to take on caretaking responsibilities. Their experience of the pandemic was completely different to mine. So again, there's kind of this, you know, responsibility or burden that falls on a certain proportion of the population where they're not adequately sort of helped. And then this just brings it out and exacerbates it. And there doesn't really seem to be much when we're just focusing on pandemic strategies alone that can kind of really balance out or mitigate these problems.
Lenora, what's your perspective as, you know, as a student, but also as a disabled person? How has this affected you?
Well, I think an interesting note on the example that you gave, it's a very difficult conundrum because that is actually something that people with invisible impairments were asking for. And just as visibly disabled people can be harassed in public for being visibly disabled, invisibly disabled people can be harassed in public if they're asking for accommodations and they don't look disabled. So it's a very difficult situation. I think the invisible needs of some chronic illnesses have come to the fore a bit with long COVID. That's been interesting to see. It's been interesting to see the prevalence of remote access, which is something we've been asking for a very long time. It's disappointing to see it's disappearing again. And I think there's been a bit of understanding of brain fog and the nature of energy limiting chronic illnesses through the focus on long COVID. But I also think that the focus with COVID has been on reducing hospitalizations and deaths, and there hasn't been enough consideration given to long COVID and the impact that will have on people. And that's very much in line, frankly, with the way that disabled people's needs have been treated throughout the pandemic. I personally struggled to find food for a while because I wasn't on the government's list of the vulnerable, and it was very difficult to arrange food shops. I know that's something that happened to a lot of people. A lot of people went without care because their carers couldn't get to them. And the government actually repealed our legal right to care under the Care Act 2014. The virus ripped through care homes because it was the Association of Directors of Adult Social Services said that social care was an afterthought in the government's plans. People were pressured to sign do not resuscitate letters or had them signed for them without their knowledge by their doctors. And frankly, the government's initial strategy, herd immunity, really kind of said it all. People who were vulnerable were just, the original plan had been to just leave them to fend for themselves. And we were reassured time and time again that, oh, COVID's only a risk to people who have pre-existing health conditions, as if those people's lives didn't matter. I began the pandemic on the phone to a friend of mine. I was 25 and she was 26 and she was writing her will. And we both knew that what she was doing was completely sensible, because there was a strong chance that if she ended up in hospital, she wouldn't be prioritized. I think we made up 3 out of every 5 COVID deaths in 2020. And for those of us who've survived, we have to live with the fact that our lives were treated as if they just didn't matter. and our deaths weren't tragic. I do think as philosophers, we have to reflect on the prevalence of eugenicist, frankly, attitudes towards disability in bioethics and political philosophy, and how that has some responsibility, the fact that this was allowed to happen.
That's a very powerful statement. And I think personally as well, we kind of are affected by it in such different ways, and certain ways you look or how you behave kind of mask the way people perceive you. And the pandemic, instead of to some extent show, you know, these vulnerabilities in the light of we need to uphold them as equals, or as, you know, requiring perhaps extra help to just have the quality of life that other people have without needing that help, is something that was missed. It was missed in these attempts to kind of focus on active solutions and trying to ponder, you know, the trade-offs, the moral trade-offs that are impossible, and all the little actions that were actually helping those that were vulnerable were completely overlooked. And in, you know, politics, in trying to have this, you know, big, broader debate without proper action that was responding to the actual needs of many. And I think that that kind of reflects in the question as well, is the invisible needs of many, because this pandemic, I think, kind of made a lot of people aware of the type of disabilities and struggles that people have, not only people with, you know, evident physical disabilities that are visible, but other type of mental health issues and neurodivergent people that struggle in different ways. And, you know, being in a lockdown, like you said, not being able to access food, not being able to access, you know, your core groups, your support groups, that obviously affects your quality of life, and it makes you even more vulnerable. And perhaps moving on a little bit into what Lucy also mentioned, that it has to do with lockdowns. When we're thinking about this, you know, the tension between those arguing that lockdowns were necessary to protect particularly the most vulnerable, but you have the other side, which is increased mental health issues, delays to other critical medical treatments, and general inaccessibility to healthcare. This makes us wonder, were lockdowns really justified? And I know this is, you know, a hard question and probably impossible to really answer, but I would like to get your perspective in the sense, do you think they were justifiable? And if so, to which extent? How would you have, you know, retrospectively think about this issue? What do you think could have changed? Let's start with Lucy.
Yeah, this is a very difficult question, as you said, and one that I've thought about a lot. And I think something that's really important to note to start off with is there's just not going to be a general answer to this question. We can't ask the questions, lockdowns, are they justified, yes or no? I mean, this is really going to just be so heavily context dependent. I mean, right at the start of the pandemic, when we were first talking about lockdowns, we really had very little idea of what was going on. Now we're in a situation where we can try to do something that's a bit closer to a sort of cost-benefit analysis. But even now, you know, it's very difficult. It's very, very context dependent. It's also obviously value dependent. But sometimes you're talking about situations, I mean, you talked about delaying medical treatments as being a reason, you know, against lockdowns. But really, when I first, I just moved to the Netherlands, and when I first came here, 2 weeks after I came here, they instituted a hard lockdown, which was just terrible. But they were really at the stage where they felt like, if we don't do this immediately, our healthcare system is actually going to be overwhelmed. We're going to really have to start triaging patients. So there are health-related outcomes on either side. And I think, you know, if you just sort of say, well, you know, this, I mean, this was a serious problem that people were not being able to access care because of lockdowns. I'm not trying to at all, but, you know, there were also problems on the other side if you don't lock down. So, I mean, these things are just very, very difficult. I think they can be justified under some circumstances, but I think the other thing is people often just get these things wrong because they can't tell with precision exactly what the situation is. Was the lockdown in the Netherlands justified? This last lockdown, I'm inclined to think that it was, given the situation that they judged themselves to be in. Was the very long lockdown in Melbourne, in Australia, my home country, where they really locked down people in an effort to ensure zero COVID for months on end. Was that justified? I'm inclined to think maybe not. So maybe the deciding factor here is, are we really close to a state where the hospital system might be collapsed? And really, if this is going to happen, then you're going to see worse health outcomes than instituting a lockdown, I think.
What are your intuitions about this, Mark?
Well, this is actually, of course, very close to home of what I do. In fact, the two pieces of research that I did do over the last year are perhaps very relevant to add to this debate. It doesn't provide any definitive answers, perhaps, but I think we should recognize that lockdowns are a tool it's just one tool amongst many to try and mitigate the spread of infection. And it's best used, I think, in the early stages of trying to contain. So I think if you look at where we were with what has proven to be not as serious as it could have been pandemic, in terms of the proportion of infected people who die, we would have really been in big trouble had it been worse in the way we've responded, because we haven't tried to contain it. Now, I'm not saying eliminate it, but contain it. And that's where you have to consider all the tools that you have. And so one particular study that we were involved in was really asking that question about the effectiveness of the timing of using that tool. And what we can show in the methods that we employed, and this is only retrospectively possible, you can't predict this from the outset, is that in the UK, for instance, had we gone 1 week earlier, then you'd have had a halving of the time being in lockdown to get to the same level, from 69 to 35 days, with 74% fewer infections, which would have been about 34,000 deaths. And if we'd have gone 2 weeks earlier, we'd have avoided 93% of the infections. So I think the point isn't necessarily it's an black and white yes or no. I think you have to use these tools and all other mitigating measures that you can wisely. And I think the problem of going late in many countries has led to failure of containment and repeated lockdowns, which could have been perhaps avoided had we achieved containment. The second study that I was involved in actually looked at the comparisons across most European countries. And it's very interesting because people ask, does this work? Does that work? And does it, if we try and compare it across countries, how does it work? And so there's one thing I would say is that we showed that the heterogeneity of different countries, the context specific nature of every country, means that you can't do between country comparisons. So you can't answer these questions. So when people try to do that, they'll find no meaningful effect. But we've universally shown of all of the countries that we could analyze, using themselves as their own control, using the methods that we did, that lockdowns were highly effective and would have between halving or even greater impact of reducing the time you needed to be in lockdown had you gone roughly a week earlier, as we showed in the UK. So that's a consistent message. That doesn't tell you whether you should use lockdowns or not and how you use them. It's just the science does, at least if you look at it carefully, say that they are a useful tool, but they're not the only tool you have in your armory, and it has to be used decisively or else it's not very effective at all. I think the other problem, which I'll just touch upon very briefly, is that people wanted to know how effective each of the tools are that we have in the armory. And I don't think that's scientifically or possible with the data that we've got. From the methods point of view, you can't tell whether closing schools would have had this amount of impact, even though some studies tried to say that. I know that they're methodologically flawed. So the problem is that we really are in the early stages, or even whilst we're still amidst a pandemic, working in the dark with a lot of information. And it's by and large, therefore, a political decision. But I would say that the the kind of political decision about keeping the economy going versus having lockdown was a false one, because if we'd have used lockdowns more effectively, we'd have been in lockdown for less of a time. And I think whilst they've been used purely to limit the overburden of hospitals, they completely, in most countries, failed to consider all the other issues we're discussing here, which is the consequences of people who are more vulnerable and those that are effectively being told to shield, etc., and the consequences of mental health and the knock-on effects with other healthcare like cancer patients, etc. All of that was secondary, I think.
Yeah, what's your perspective?
Well, I very much echo what's been said so far. I mean, I suffered personally because of the lack of access to healthcare. I've actually lost most of the hearing in this ear because I wasn't able to get treatment for an ear infection soon enough. And I know that many, many chronically ill people from Research for Chronic Illness Inclusion suffered. But as Lucy said, the lockdowns may have been the only thing that stopped the NHS collapsing. You can't say healthcare would not have been improved if the NHS had completely collapsed. That would not have improved our experiences. I think it's hard to say the specific details of exactly how the lockdown should have happened, but I think the problem was not that we had them, but how we had them. And I think exactly as Mark said, we had them, it started much too late. Too late. And I think also, again, as Mark said, there was a bit too much focus on the economy. I think if we had perhaps offered people adequate sick pay, we wouldn't have had so many people, not testing and going in and having to weigh up the risk of, do I risk spreading COVID or do I not feed my family? And I think we rushed back to in-person work too quickly under the guise of the economy. I think if we had prioritized protecting the healthcare service, that would have been much better if that had been the top priority. And I'm very skeptical of the way that the government wields mental health concerns as justification for not imposing further COVID measures, given that the Conservative governments have consistently underfunded mental health services in this country. And the NHS, which is part of the reason that the NHS struggled so much, is because they've been on the brink of collapse every winter with flu season. They haven't been funded properly. If we had prioritised the NHS better, we would have been in a better situation. I'm not completely convinced by, say, Sajid Javid's concerns about people's mental health.
Yeah, that's a terrific point. And it kind of shows like what Mark mentioned in the sense that this come down to be political sort of decisions at the end, because when you don't have the science, when you don't have, the hardcore data trying to, decide exactly what's going to happen because you cannot predict it, then these decisions should be based particularly on the interaction and the needs of individuals and minority groups that were completely dismissed by the economic interests in this case, and perhaps even like a panic almost reaction to what was happening. It's like, we need to act soon, but in that deliberation that took too long in some cases, it was eventually too late to actually address core fundamental issues that would have changed the lives of so many. And now, because of time, I think it's good that we move to the second area that has to do with the science of it all, misinformation, manipulation, and lack of trust. And one aspect that is worth discussing is that of communicating. And Mark mentioned it at the beginning. And I'm just going to give an example, but feel free to go outside this example that has to do with sort of major criticisms that appear when looking at how Black, Asian, and minority ethnic groups, how is they're called in the UK, receive information and messages. But this obviously applies to other minorities. There has been some discussion about how culturally appropriate certain ways to address these issues are. And that makes us wonder sort of barriers that can appear when it comes to influencing individuals that are prone to be misinformed, to be manipulated, and to develop a lack of trust in authorities. I mean, we have seen it. Some people actually perhaps were on the verge of trusting and not trusting, and because of the decisions of the pandemic, they decided not to trust. So what is your perspective on these barriers of misinformation and manipulation? And how do you think historical experiences with authorities play a role in this distrust. Let's start with Leo.
I do think that when it comes to racially and ethically marginalized communities, it's very important not to place the blame for the distrust on those communities. Medical and scientific experts have, in many cases, lost the trust of these communities for a reason, from sort of historical issues like openly racist eugenicist ideology and extremely harmful dehumanizing research practices, to contemporary problems like the recent BMA survey earlier this year that found the NHS absolutely riddled with racism. The fact that we know, for instance, Black mothers are 4 times more likely to die in childbirth because their concerns and their reports of pain aren't taken seriously, and that just the default body in biomedical research is white. Heidi Graswick calls these epistemic trust injustices, where because of ongoing failings, scientific experts aren't always able to satisfy the conditions of the responsibly placed trust of marginalized communities. And then, of course, there's the broader problem of the institutions that the biomedicine is a part of, and all sorts of broader problems of societal racism that can cause communities to be insular. I think this calls for institutional change, and it's not the job of those communities to change. It's the job of institutions to show that they can earn people's trust, and they can't do that for as long as they blame the lack of trust on those communities rather than accepting responsibility.
Terrific point. Lucy, what's your perspective about this?
Yes, I mean, I think that this is right. So I'm thinking of Indigenous communities in North America and in Australia. And you really saw there, if we focus specifically on vaccination, that there was really low levels of vaccination, really due to extreme distrust, and very exactly as Leonora said, very warranted distrust, very understandable distrust. But I use the example of vaccinations here because there's been a lot of interesting research on vaccine refusal, not just in relation to COVID, but in relation to other vaccines. And something that's often talked about as really essential is having the message spread not through scientific authorities, but people that are trusted within the community. And this seems to have been hugely effective in some places with Indigenous communities in North America, having people that are actually trusted come in and talk to people. I mean, this just seems like a much more effective strategy. There's been a lot of work showing that where religious leaders can talk to people about vaccination, so it's not just a matter of them sort of saying, yes, I believe that this is the right thing, but having the opportunity to go in and engage with people and listen to their concerns, and there's someone in a position of trust and authority that the people in the community respect. This is just a much more effective way of having people feel heard, having their concerns met, and then ultimately convincing people to be vaccinated.
Mark, what's your perspective on this?
Well, I think that in the modern era, we're completely awash with information, so you can't fact check it all. And the only way that people do make any sense of this is through the trust mechanism of specific bodies or authorities that they identify with. But it's therefore not the lack of information per se that's the problem. It's not the being in kind of like a head buried in the sand situation with information. It's the fact that there's proactive attempts to sabotage the value of information. There's quite destructive mechanisms at play on social media to other certain groups, and to create a breakdown of trust that I think is exceedingly divisive and is used for all kinds of reasons for various groups. And we've seen this perhaps suggested in terms of political campaigns and also around in the UK, the Brexit outcome. And I think once you start to divide society in that way, you break down trust, and you by othering subgroups of people, there's no way that information, no matter how sound, will get through, because it's the basis of trust that they're working with, not the information. And I think that, again, specifically, sadly, in the UK, the actual government itself has probably lost a lot of trust in terms of truth, because there seems to be a complete abandonment of truth. So I think the problem we have is the way that these social media platforms currently operate. I don't think we'll go backwards in the sense that we can't put the genie back in the bottle. I think what we have to do is to get organizations that can communicate rapidly, rapid fire communication like Twitter and Facebook, to be more responsible. There's been a lot of talk and call for that already as to how far we'll see that will be policed, like not having anonymous accounts, trying to reduce the number of bots, or identifying bots at least. That's really important. I think at least within the European setting, we're facing an interesting situation that's showing that the people of Europe are coming together over one issue, which is perhaps ahead of some aspects of our UK government in that respect. That's the Ukraine plight, of course. So I think I'm optimistic. I think we can address these problems, but I think at the end of the day, it's not putting the responsibility into the minorities to sort this out. It's actually in government and professional bodies, institutions that have to be able to reach out. And quite frankly, particularly within health, I think there is still a predominant institutional problem, the lack of diversity at the very top of most of our institutions, in fact.
Yeah, that seems to be like a common thread when it comes to understanding how misinformation runs as well, because lack of representation at different levels always ends up losing, perspective when it comes to finding appropriate solutions, efficient solutions, and ethical solutions to these issues. Considering the time, I think it's time to move to area 3. So Macarena, you can take over.
All right. Following talk about these worries, right? About trust, misinformation. It's necessary to talk about, Mark mentioned before, about the role of social media in the communication of health crisis, what pandemic is, right? So we have social media can be transmit quick the information, but misinformation as well, and fake news. So thus create filter bubbles. So that's impede contrasting critical points and limits the knowledge possibilities of citizens. So considering this, how do you think about social media effect in this, in how the message is spread and gave for people? Is the role is for worse or for better? Is help or not in the moment to transmit crucial information about how COVID is COVID transmission, or how vaccine works? What do you think about it, Leonora?
I think Mark's said a lot already. I'll be really interested to hear more of what Mark has to say about this. It's very obvious that social media allows perpetuation of misinformation, because frankly, it seems as if misinformation can be profitable. If you look at Spotify and their refusal to take down Joe Rogan, for instance, there's money to be made in lying to people, and it's easier to spread lies, I think, often than it is to spread the truth. It's also worth noting, I think, that social media has had some positive influence. It's allowed experts to talk directly to the public and to criticize the government and government scientists, and to hold them to account at times, which has been really helpful. It's allowed a lot of doctors to talk directly about their experiences working in healthcare, how harrowing it's been for them. And it's allowed marginalized communities to speak about what's happening to them. Disabled people who are so disempowered and disenfranchised have been able to share directly their experiences through social media. Given the fact that many of us have been locked up in our homes for 2 years, I'm not sure how else we would have got those messages out. And I think perhaps linking back to sort of the previous question, distrust of the mainstream media as well can sometimes be justified. If you think the Muslim Council of Britain's Centre for Media Monitoring, their report last year found out of 60% of articles, of 48,000 articles that mentioned Muslims in Islam, 60% of them were negative, and 1 in 5 talked about terrorism. So where there is this genuine and well-founded distrust of the media, social media fills that gap, and it makes it a lot harder to monitor and verify what's being said.
Lucy, what is your perspective about this?
Yeah, I mean, I think I'd echo what Leonora said. I mean, it's very hard to determine exactly what's going on and how much, problems can be traced specifically to social media. So, I mean, clearly there are, difficult things going on here. This is a very difficult situation. If you go on Twitter and read, people trying to discuss anything, it just makes you despair. At the same time, I mean, what role exactly filter bubbles are playing, I think is very difficult to determine, and an empirical question, which I just can't really weigh into. And it should be noted, again, if we focus on vaccines, that there was widespread misinformation about vaccines that predated the internet. So I think, it might be a bit misleading to attribute this all to sort of this new phenomenon, although, there can certainly be factors here that exacerbate things. But I think, where Leonora talked about the positives of social media, I guess I'd also point to the potential of social media. So, I mean, if we're really talking about misinformation, the fact is now that just a lot of people get a lot of their information now from social media. This is where they're getting the information. I read very interesting work from the Royal Society about tackling vaccine skepticism, and they were really focusing on how do we use social media to reach people. This is the way that we can reach them. They're not going to see what the World Health Organization, what pronouncements they're making today. They're getting their information through these sources. How do we reach them there where they are? And how do we communicate with them in a way that will actually get through? I think when we're really talking about tackling misinformation, this is the kind of stuff that we need to be focusing on, also involving social media.
Mark, what is your point of view?
I think that it's not a lack of information and perhaps a filter as such. It's not kind of bubbles of thinking that are the problem. I think there's a lot of information. I think it's the echo chamber of anxiety that's being exploited. And I think that what we've seen is a massive expansion of social media ahead of perhaps governments and institutions catching up to the power, the positive power, but also the negative consequences of it being misused. And that requires, I think, some aspects of legislation that would put certain things a little more back in the place that they should be. But I don't think we're going to be able to, as I say, put the genie back in the bottle. I don't think we'll be able to undo this. I think what we have to do is to get used to and embrace and develop mechanisms of actually putting out there what is a proactive building of trust through social media, to get people to recognize that the information is worth paying attention to, because at the moment there is just an attempt, it would appear to be quite common, to just denigrate people, basically to actually try and break all form of trust and absolutely create othering as a norm. So it seems to be the time of trying to divide people through social media. But there's enormous power in social media because it is a very flat system. It's a very empowering system. And I've seen things influenced due to voices expressed through social media that have actually brought about positive change. So I'm not going to criticize the existence or use of social media in general, but I would say it needs to, our institutions need to catch up, our governments need to catch up in understanding that that we've got to be more careful and responsible about how we allow social media to operate. And I don't have any personal ideas or suggestions on what that is, but I think we should just try and improve what we've got and use it more positively.
there is no doubt about how social media impact in this, especially in this time, how people is informed about different topics, right? So it's really important that government and scientific community use this tool effectively, because there are many people use like bots, for example, for bad ways. So the impact is really negative. In the give the properly the information, especially in crisis, in pandemic context, is really, really important. Now, there is another issue that is really important as well, is the distribution of vaccines. Because of course there are unequal distribution, right? Because we have high income countries can offer to population 3 or 4 doses of vaccine. In contrast, in low income countries, just the 10% of population had received just 1 dose at the beginning of 2022. So the question is, what this situation, this unequal distribution of vaccine, does like vaccine apartheid, what this situation tells us about the relationship between scientific knowledge, technology development, and power. So how can we combat this injustice? Lucy, what do you think?
This is just such a difficult question, and kind of, I guess in some ways, kind of a classic problem in philosophy. I mean, you've sort of got this seeming contrast between the self-interest of countries, and this is legitimate interest. They need to act in the interests of their own members, versus, you know, the interests of sort of the global community. But what makes this situation even more tragic is it's really in all our interests. I mean, you had this, you know, particularly towards the start of when vaccinations were being introduced. Look, you know, we need a sufficient proportion of the entire world to be vaccinated. Otherwise, we're just going to see an emergence of a variant, which, you know, people might not be immune to, and this thing will just keep circling around and around forever. So this is just such a terrible situation, such an important issue that needs to be dealt with. I'm not sure what the best way of dealing with this is. I mean, we had the COVAX program, which seemed to me like a good idea in theory, but it obviously didn't work very well. Maybe, you know, I wouldn't want to say this with too much conviction, because I just don't think I'm well versed enough in the sort of issues you need to know about here. Probably a solution is going to have something to do with giving countries the capacity to produce supply of their own vaccine.
Mark, what is your perspective about it?
Well, a pandemic recognizes no borders. So I think we are actually living in one country Earth when it comes to this, one shared space really when it comes to this type of problem. And I do emphasize that we could have probably done better with this pandemic if we'd tried to contain it, but we didn't. It's just as well it wasn't that severe, because if we get another big one, I'm not sure whether we've learned anything about behaving differently. And I think that whilst the individual countries will want to look after their own population, and that's driven by the political will to be seen to be doing that, the reality is with the global traveling that we have, we are going to just keep feeding the potential variants and you know, not really get rid of the problem of huge expense of having to annually or every 6 months vaccinate people. And again, what, you know, we've focused on inequalities and the minority groups. This is just going to widen those gaps and put greater pressures on those subgroups across the world, because the priority will be seen that we can't keep this up forever and we have to keep the economy going, etc. But if we don't vaccinate the entire world, no country is safe. But then there's the problem of building trust so that the vaccination within countries can achieve herd immunity. So there's another issue coming back again to the problem of trust and how we communicate. And we've really got to tidy our act up and institutions, things like WHO, I think, they're trying to do their best, but most institutions probably need to get their own house in order, really, quite frankly, in terms of understanding diversity and challenges of minorities a lot better, in terms of therefore recognizing what's good for one is good for all. And if we don't do that, then we're shooting ourselves in the foot. And I honestly think there's a risk that we won't survive the next one.
Leonora?
Thank you. Yeah, that was very interesting, and I do very much agree with both Lucy and Mark. I think this situation speaks volumes about the situation of humanity in general at the moment. We have these unprecedented scientific developments that have the power to improve the quality of life of all people, and instead all they seem to be doing is consolidating existing global inequalities. The rich seem to get richer, and it's very hard to understand how some developing countries are going to recover from the impact of this pandemic economically, honestly. I think one of the things this shows us is that public health should not be a for-profit enterprise, because clearly, as the behavior of pharmaceutical companies who are holding so tightly to their patents shows, that it's often more profitable to let people die. We can't solve these problems in that way. I think also to think about the question about racial and ethnic minorities at home, I don't see how scientific institutions are going to be able to regain the trust of these communities when they see racialized people all over the world being left to die, who in the cases of many immigrant communities can be people they know, their family and their friends. It's hard to say what we can do. I think we can try to hold governments, institutions, pharmaceutical companies accountable. One simple thing we can all do is don't buy into the lie that these people's lives don't matter.
Just a tiny point of that, just wanted to comment about one aspect that is sometimes overlooked, that it has to do with the recognition of inherent vulnerabilities that are historical, not just in how people are treated, but the consequences of that treatment that has to do with, for example, people in Africa that have consistently, generation after generation, been completely neglected. So their vulnerability to a pandemic is completely different, despite even if you have the possibility of giving them proper vaccines or proper help, it might be too late in that sense. So structural changes, I think, are, like Leonora said, making us think about how we should reconstruct the way we see ourselves as a society, as, one world, like Mark said too, living together. And what we really want to change, do we want to completely ignore and pretend like this is not happening, and just live in our little countries and just care about ourselves? Or do we want to actually break those barriers and be aware that the price that we're going to have to pay because of how we've let it happen up until today is going to be quite pricey, but I think it's worth paying in the long run, if that means that we're going to, break the structure that is putting all those people into that extreme vulnerability.
It's so frustrating to see, like, in diverse situations, not just pandemic or wars, the same minority groups are vulnerable, are hard and harmful. The same people is receive damage about it, and the same people is benefit. The elite is benefit. It's really frustrating to see the same things in different contexts, different story, but it's the same result. So now it's really relevant to talk about the learning of this situation. So the closing open question for all of you, what we learned, or what should we learn about pandemic? Leonora.
I think one thing I hope we've learned is just something that disabled people and feminists have been saying for a very long time, is that we're actually all far more interdependent than we realize. We all depend on each other. Labor that we had called unskilled actually turned out to be essential to the functioning of society. And I hope we remember that. The dependency of disabled people is in many ways a difference of degree, not kind. There are actually all sorts of accommodations that we don't call accommodations that everybody depends on all the time and can't live without. But for some people, this is something that renders them dependent and should be demeaning, and for other people, it's just life as normal. I think we've also learned that the way that we think matters, the way that we theorize matters. For as long as we have a very individualist approach, we're going to struggle to deal with these sorts of situations when we think of ourselves as kind of individualized, atomized people who only need ourselves and don't need to worry about other people and don't need to think about our responsibilities towards others. And to, I suppose, end as I started, that the kind of eugenicist thinking that proliferates in a lot of ethics, bioethics, is very deadly and it's not just armchair philosophizing, it has serious consequences.
Lucy, what we learn about this situation?
Yeah, I guess I'd also like to loop back to what I said at the start, but I think that the pandemic has really it's put additional stress on existing situations, and it's kind of exposed, really laid raw, already existing problems. So, I mean, we can really draw this kind of lesson about anything that we've talked about, you know, global cooperation, about communication, trust, social media, but also just about the inequalities that already exist in society that were really exacerbated by the pandemic. So I started by saying, you know, really, whether you lock down or don't lock down or have contact tracing, there are always these particular groups where the brunt of the measures fall on them. I mean, this is just something that is adding stress to an already, you know, unequal burden in society. And I think, at least to me, it really exposed those kinds of inequalities in a way that I wasn't as cognizant of before. And I think, you know, and it shows us that something needs to be done about them that is not just about the pandemic.
Mark, what is your perspective?
I think we've learned that we don't need to live life the way we used to. I'm not suggesting that we stay glued to screens and live life in the way that we're operating now, in every way, in every aspect of our daily life, but it clearly wasn't necessary to do a massive amount of commuting, or, you know, the lack of trust issue again about people being able to work. I think we've shown that you can still continue to be productive if people aren't looking over your shoulder. And I think that's going to be good for the planet, given that we've reduced a lot of unnecessary travel. In terms of what we've learned about the pandemic, though, I think that's very mixed, because I would say that I hasten to add, I am optimistic, but I fear at the moment we are not really learning anything, because I think we haven't understood how lightly we've got off with this one, but we will perhaps take stock. But I think ultimately the issue is that we are one country, Earth, whether we like it or not, due to the interconnectedness, and anyone who thinks otherwise is delusional. And I think the sooner we get all governments to try and work towards that, the better. But of course, you know, there are these pressures of people who just need to keep counting money for some reason. What do they do with it? Where's it going to end? So I don't know why we need to keep driving such inequalities, because I would imagine a fraction of what most of these people got is sufficient for them to be happy. but there's obviously another drive to this, whether it's, you know, sadistic or whatever. I don't really understand why we have to do this to people. But until we resolve that collectively as one country Earth, I think we are vulnerable. So going back to the problem of another pandemic, if it's more severe, I do seriously worry about the consequences, because we haven't necessarily learned how to deal with it as a globe at the moment.
I just wanted to touch, also to conclude, on what I've reflected, not just during this conversation, but also on my own, that has to do with, we have proved ourselves that we are able to actually see and accommodate the needs of those most vulnerable. This is proof that we can do it. And going forward, I do truly hope that either ourselves in whatever position of power, how little it is, that's another debate, but we can actually be more aware and mindful of the people around us, to be more to have more respect about their needs, and to internalize the fact that, like everyone said here, we're all in this together. And that actually means we're all in this together daily. This is not just about the pandemic. This is about how we've experienced this pandemic, how we've seen ourselves and others, and how much we can learn from this suffering and turn it into proper accessibility and proper accountability when it comes to respecting everyone's vulnerabilities, especially of those that have been consistently left aside in history by governments, but also by society. I've learned so much about like your own struggles, Leonora, like Lucy, when you went to another country, you were completely locked down. I myself been deprived from seeing my family for 3 years. And those things matter. And I think those things make us more human. And I think it's important for all of us to take this as a lesson. And hopefully we can apply it in the future in whatever we do.
Well, I hope that we don't lose this really great opportunity to reflect about how we relate with others, because we have in a society really individualist. So the sense of community, how we see the other people, is really important. But unfortunately, it's to see like, okay, come back to pre-pandemic context. So wherever is I'm really sad. So well, Leonora, Lucy, and Mark, thank you very much for your great disposition to participate in this panel and share your perspective, your personal view about this pandemic context, your experience and thoughts. It was really interesting listening to you. So thank you very much. And thank you to Gabriela for generating this space of reflection. Thank you very much.
Thanks for asking.
Thank you, everyone. I really appreciate it.
Yeah, thank you.
And to everyone watching, thank you for joining. Hope you find this helpful. And if you have any questions, or if you want to contact any of us because you have something to say, feel free to do so. This is an open space, and